Samson Wambugu. I'm a member of the PCEA Ongata Rongai Health Board team, and today I'm going to educate the congregation about what is coronavirus and to what effect the coronavirus have affected our community at large. So basically, I'll start with what is coronavirus. It's a tiny molecule which is around 400 to 500 microns. That's the size of a coronavirus. Basically, the virus, it has some protein spikes which are crown-shaped, and the shape of the, in Latin, the crown shape is what is known as now the corona. That's where the name coronavirus comes from. We have different types of coronaviruses. Some of them are affecting the respiratory system, and some of them are affecting the gastrointestinal system. For the respiratory system, some of them cause some mild condition or some mild symptoms, such as for the mild ones, some of them will cause the common colds or the coughs, and some of them will go up to pneumonia. Some types of coronaviruses will extend up to cause some severe diseases, and that's where we get the severe acute respiratory syndromes. The SARS, that is severe acute respiratory syndrome SARS. Some of them are the MAS, which is the Middle East respiratory syndromes, also will affect the human beings. Basically, after that, we have some of the causes of the virus. From the viruses, you see, when we talk about the severe acute respiratory syndrome, which is the SARS, it is a virus which was first identified in China in the year back in the year 2003. And the year 2003. The other one is the MAS, which is the Middle East Respiratory Syndrome, which was identified in Saudi Arabia in the year 2003. We have different types of the viruses which we've had so far, most of them causing the severe acute respiratory syndrome, and this is into the worst condition. So one of them is the severe acute respiratory syndrome. This is a virus which was first identified in China in the year 2003. The next one is the MAS, which is the Middle East Respiratory Syndrome, which was first identified in Saudi Arabia in the year 2012. And right now we have the coronavirus, which is a virus was first identified in China again in the year 2019, December. The origin of these diseases, as I had earlier mentioned, the first one was the SARS. The SARS, the severe acute respiratory syndrome. The origin of the virus, the origin is mostly from animals. One, you can say from the SARS, we have the bats. From the bats, it could also originate from cats. The other one is the MAS. For the MAS is the Middle East Respiratory Syndrome. This, which was identified in Saudi Arabia, the origin of it was identified in camels. And right now we have the COVID-19, which is a novel COVID-19, which is novel means new virus, and it was first identified in 2019. And studies have not shown where exactly it is originated, but some studies have shown that without much evidence, but it has shown that some of them was also originated from cats, and also mostly from the bats, but basically from animals. Transmission of this disease, of the coronavirus. This virus transmission is basically from droplets. That is from when someone coughs at a close range, the droplets can travel which a distance of around 1 meter. So someone who is infected and they cough, the droplets can pass from one person to the other. Again, contaminated surfaces. Someone has coughed, and the surfaces which they're not clean. They have the viruses on the surfaces. You maybe touch your mouth, you touch your nose, and also you touch your eyes. Good. We are again now going to discuss about the groups at risk. The groups that are at risk, we say, because we first said that the virus mostly it originated from animals. So we can say people handling animals, the researchers, people who are researching things about the bats, the cats, the camels. This is where the virus can. Most people handling these animals can be at risk. People consuming live animals feeds. Again, we can also say group at risk. These are people who are taking care of the sick, our healthcare workers. Our healthcare workers, these are a group of people that can be at risk. As another group of people, category of people, these are people who are taking care of the sick ones at home. Maybe you have a family member who is in quarantine, self-quarantine, or who is not feeling quite well. You attend to this person. At some point, the virus can get to you with the little information that you didn't know that the person was infected. Good. Let's now discuss about the symptoms of coronavirus. The symptoms ranges from the mild to moderate to severe. For the mild cases, you can get someone with a low-grade fever, with a cough, and the cough most of the time is dry. Then it will again go to the moderate, where the cough will be severe. The person might have shortness of breath. The person could have general body weakness, general body malaise. From there, the symptoms can go. Of course, now this person has high-grade fever, around 40, and the person will have maybe renal failure, kidney failure, multiple organ failure, and hence, to the worst, there's death will occur. Good. From there, now you're going to discuss about the diagnosis of coronavirus. Coronavirus, currently you cannot diagnose coronavirus by looking at the person. Basically, for now, we're just doing a lab investigation. So there's what is called PCR, polymerase chain reaction, is what is done by in our labs. So when someone has a history, there's a criteria. Maybe there is history of traveling. The individual has fever. The individual might have come into contact with someone who has coronavirus or suspected coronavirus. So you fall in the category, in the criteria of getting into the lab and getting tested for coronavirus. And now the lab will be able to show us the results. If it turned out positive, an individual will be taken out to isolation. From there, we go to the treatment of coronavirus. We do not, up to date, we do not have a definitive treatment of coronavirus. Neither does coronavirus have a vaccine. What happens right now is, up to date, what we are doing for any patient that comes to us, the patients, we just treat them symptomatically. We treat the symptoms. If the patient has fever, we give them something for fever, antipyretic. If the patient is dehydrated, we give them some fluids. If the patient has shortness of breath, cannot breathe well, from the gadgets that we do use to check, the patient can be given supplemental oxygen. What we're doing is supportive treatment, also psychological care for the patient. The patient, maybe they're not feeling well, they have sick. In our facility, we'll be able to take them into counseling as well, so that it's a supportive treatment, but we do not have a specific treatment for the coronavirus. Something else that I can say we're going to talk about now is the prevention of coronavirus. Coronavirus, as we said, these are droplets. When someone is infected, they cough. The droplets can travel from up to around 1 meter and fall on the surfaces. So prevention, what do we do? First things first, we say is people should practice good hygiene. And by hygiene, we start with hand washing. You wash your hand with soap and water. Soap and water. You should make it around a minimum of 20 seconds. If you don't have soap and water, you can also use alcohol-based hand rub to also clean your hands all the time. From there, you should also, whenever you get a cough, do not blow on your hands. Otherwise, right now, you bend your shoulder and cough from there, so that you don't spread the virus or the droplets in your hands. Avoid touching of surfaces all the time. Minimize minimal interaction on the surfaces, because you don't know what is on the surfaces. And for instance, if you happen to do that, avoid touching your mouth, avoid touching your nose, and avoid touching your eyes, because now you could have carried the virus on your hands and now transmit them to these surfaces. So by doing this, again, another thing you also need to implement is social distancing. By social distancing is that from you and from one person to the other, maintain at a minimum of 1 to 1.5 meter distance from one person to the other, such that when someone coughs, when someone who is infected coughs next to you, the virus cannot come to your side. So again, when someone is infected, or you feel you're not feeling quite well, you feel that you have a cough, the fever, the symptoms that we talked about, always what is advocated right now according to the Ministry of Health, you should not, and of course you have history of traveling maybe from those countries that have been affected with coronavirus. The Ministry of Health has said, whenever you feel the symptoms of coronavirus, that is the cough, the dry cough, hotness of the body, that is you have high fevers, you have shortness of breath, and you also have history of travel from those affected countries, or probably you might have come into contact with someone who is infected with coronavirus, call the Ministry of Health using the number *719# or 719, and the ministry will be able to send you an ambulance which should come and pick you and take you to their quarantine center and for further testing and further investigation. So avoid using public transport whenever you feel when you're not feeling well. Stay at home, make the call so that what we're trying to do is avoiding contact with other people, and hence you might spread the virus. Whenever you use the public means, our matatus, so the spreading can be quite high, and you're trying so much to minimize contact from infected people to uninfected people. Hence the spread can be there. Thank you so much.
It is the easiest way of keeping children occupied. But remember the negative effects of watching too much television. Balance between screen time and other activities. Monitor what your children are watching. Remember, during this period, a lot is about COVID-19 pandemic, and children might not be able to process all the information positively.